歡迎大家嚟。
Welcome to the press conference of the Public Accounts Committee. Mr. Xu and two other lead members will first speak, and then we'll open the floor to have a Q&A session. Mr. Xu Ka-fai. Thank you. Welcome to the press conference of the PAC. Today, the committee has tabled in Council its report number 82. Of the 8 chapters covered in the report of the Director of Audit, the committee has decided to hold public hearings on 2 of the chapters, which include Chapter 2, Emergency Dental Services and Elderly Dental Care Support, and Chapter 5, Provision and Monitoring of Rehab Bus Services. As for the 6 other chapters, the relevant bureaus and departments and organizations have, at the request of the committee, addressed members' issues of concern in writing. I will first invite the 2 respective lead members to briefly introduce the 2 chapters on which public hearings were held, and then members of the media may raise questions. I'll now invite Mr. Edmund Wong to brief Friends of the Media on Emergency Dental Services and Elderly Dental Care Support, Chapter 2. Thank you, Chair. Regarding report number 82 of the PAC, we have noted that since 1947, the government has been using government dental clinics to provide civil servants and their dependents dental benefits. They have also made use of excess service capacity to provide free emergency dental services to the general public. The disc quotas for emergency dental services decreased from about 40,000 in 2018 to 19 to about 20,000 in 2022 to 23. There is inadequate supply, as we have noted. When responding to the concerns of the Audit Commission and the Public Accounts Committee, some enhancement measures were proposed by the administration, including increasing the number of places to approximately 60,000 and preventing people from having to queue at nighttime. We will soon move to an electronic disc distribution and registration system. We also have the Dentists Registration Amendment Bill 2024 that would help relieve the manpower shortage in dental care services in Hong Kong. We have also noted that there are some deficiencies with the Outreach Dental Care Program. Through multiple measures, we believe that will help with providing the services elderly persons need. That's it for my report. Thank you. I'll now have Mr. Porter brief Friends of the Media on Chapter 5. Thank you. As you may note, since 1978, there have been rehab bus services, and since 1980, the government has been subsidizing such services. In 2022-23, subvention amounting to $125 million was provided. But then right now we have 7,125 individual customers, and we have 100 odd organization users of rehab bus services. But then we do see the utilization rate being quite low. It may be because there is a mismatch of demand and supply, and there has been a long waiting time to have certain services provided. I will not go into the details, but I think when this was promulgated, we do not have much barrier-free transport, and now the context is different. We have many different options. We now have 4,000 odd barrier-free taxis. We have 6,200 low-floor buses. We also have a number of low-floor minibuses. We also have MTR services. SWD would also provide relevant subsidies. PWDs also enjoy the concessionary fare of $2 per trip when taking public transport. So we have proposed that we should review whether there are alternative transport options for PWDs to take, and the government can review its allocation of resources. We urge the government to conduct such reviews as soon as possible. We also note that the Transport Department should consider whether relevant MOD requirements with operators are met, whether there is any need to enhance efficiency. There should also be more stringent monitoring of accounts of operators. These are the concerns we noted. Ms. Carmen Khan, in particular, raised the concern that MOUs signed with operators are not legally binding. We urge the administration to review whether that is effective monitoring. The administration said they have followed the FSTB's number 9/2004. The guidelines have been in use for quite some time, but that is not ideal. The arrangement, that are the two major concerns we had, and we urge the administration to make sure there is effective monitoring to make sure operators comply with the MOU requirements. Thank you. Any members who would like to add something? None? All right. Friends of the media, any questions? Thank you. Regarding the two chapters, any questions from the Friends of the media? Well, I suppose we gave too many details during the deliberations of the PAC, and the two members have made very detailed reports. Friends of the media thus do not have any questions. All right. If there is none, well, Ms. Young, you would like to speak. Well, I was in particular concerned about how to minimize the time needed to distribute discs. We have urged the administration to, before the launch of online electronic disc distribution registration system, there should be review of the queuing arrangement. The government has promptly responded to that and made adjustments. Before, preliminary registration would start at midnight. Now it has been made to start earlier at 8 p.m. The Public Accounts Committee also suggested that there should be teleconsultation of dental services. We are glad to hear that the administration would keep an open mind and would draw reference from overseas practices and other examples to see if there are any changes that need to be made. We also want to ask the administration to make good use of technologies to facilitate this distribution and would provide more convenience to the public so that they do not have to go to the clinics multiple times. So I urge the administration to continue to improve the arrangements. Thank you.
Other members? Ms. Karen Khan? Ms. Carmen Khan? Well, you may note that in our report, we use some special terms. Deeply concerned, unacceptable are two examples. in respect of the monitoring of the operator by the Transport Department, especially in the utilization of subsidized vehicles for the self-financing activities. We use the term unacceptable in our recommendation. We want them to split the accounts. They have done so in respect of direct costs, but not in respect of indirect costs. So we are concerned about this, and we are dissatisfied with the approach. And also the use of MOU, which is not legally binding in the offering of subvention for this operation. This is unsatisfactory. Since this is not legally binding, then the parties concerned will not be too serious about keeping their promises. So we are glad to see that the government has promised to do something. They talk about regularly review the MOU and review in a timely manner to ensure that the monitoring mechanism can adequately monitor the operation. And the FSTB would also, the review is a financial management guidelines, because the Bureau has told us that they are complying with this FSTB's note circular and guidelines. So we have looked at the monitoring of the Transport Department, and since the guideline adhered to by the Transport Department will be revised, then other departments would also be doing the same. All right. Further questions? No? All right. Then that concludes the press conference. Thank you.